Aloha, guys. Dr. Thomas back coming at you. We're going to finish up our section on bones and skin and all. We mentioned this: sinuses, hollow air cavities within a bone. Styloid process, pole-like process extending downward from the temporal bone on each side of the skull. They're like little thin muscles attached to them. Suture is a movable joint between bones. It's also stitches when you get sewed up. There are several of them in the skull. TMJ joint, temporal mandibular, is a jaw joint. Tendon connects muscle to bone. Trabeculae, supporting bundles of bony fibers in cancellous or spongy bone. Vertebra, the vertebra, the backbones. 7 cervical, 12 thoracic, 5 lumbar. And that's it normally. Xiphoid process, at the bottom of the sternum, you can feel a little bony tip. That's it. Yellow bone marrow is fatty tissue, and medullary bone is inert. It's red that makes the cells. The yellow is just kind of takes up space. Fractures, again, we'll learn these in A and P. If the bone is ripped through the tissue and is exposed to the outside air, it's called an open fracture. Compound is what it used to be called. That's an old, antiquated term. I don't know why they don't put open here and put compound in parentheses. That's the way it should be done. Simple fracture is still contained within the tissue. Compression fracture is often seen in the vertebra where they crush. A comminuted fracture is one that's been crushed. That would have to have extensive surgery. A green stick fracture, like you take a dry stick, it pops. Take a green stick, it goes, and it still stays attached. You can have a fracture like that too. Pathology, here's normal bone. Look at all the spaces. This is someone with osteoporosis. Porous bone. It's linked to hormones, guys, so it's common in postmenopausal females. Terminology: ankylo means stiff. Ankylo means stiff. Usually a joint. Arthro is a joint. Articulo is a joint. There are fluid-filled sacs throughout the body that help act like a bearing and diminish friction. They're called bursa. Chondral cartilage, we've gone over that. It's very important, but we've mentioned it several times. Ligamento, of course, is a ligament, bone to bone. Rheumato, watery flow. Yeah, but that's like rheumatism. That's an old term. Okay, many of the joints in the body are what are called synovial joints. They're freely moving, they have fluid in them, and they're surrounded by a membrane. And that's what this is. Tendon is for tendon. Tendinol is also tendon. Muscle to bone, muscle to bone, muscle to bone. Desis, to bind or tie together. Okay. Stenosis is narrowing. This one is fairly uncommon. Stenosis is one you need to know for sure. Well, all these guys you need to know them, or we wouldn't have them in here. And also they'll have to be asked on a test. When something becomes stenotic, it becomes narrowed, and that's an important term to know, because usually that's not good. Joint articulation, where bones come together. Suture joints, immovable like the skull. In the adult, the bones of the skull are fused together tightly. Synovial joints, I mentioned those a moment ago, freely movable like the ball and socket of our shoulder and hip, the hinge of our elbow, etc. Synovial joints are quite complex. Here's a picture of the knee joint, a drawing. You'll see this in A and P. Here's a lateral view. Here's an anterior view. See, here's a ligament, bone to bone. Here's a ligament. Many of you have heard of the ACL. Anterior cruciate. A lot of athletes have that ruptured. They have to go in there and repair it and replace it. The knees are classic examples of synovial joints. Okay, here's a drawing showing osteoarthritis. There are over 100 arthrotides, but the most common is osteoarthritis. And on an x-ray, it'll look like this, where you should have this nice, smooth joint space. It'll be all raggedy and messy looking. And if it's real bad, guys, they have to have a joint replacement, or they're going to be hobbling forever. You'll go over that again. That's a stylized joint. It really doesn't specify what joint it is. Carpal tunnel syndrome is very common. You're going to have it in A and P. The median nerve, one of the 5 nerves in the arm, goes through a tunnel created by the positioning of the carpal bones and the tissues, and it can often get pinched and cause numbness and stuff in there. It's a common problem. I've treated many cases of it. Clinical procedure in the bones are arthrocentesis is when they draw out fluid. Arthrography is where they do a specialized X-ray. Arthroplasty is a surgical procedure on a joint. Arthroscopy is where they scope. Like if you have a friend that's an athlete, and they got to have my knee scoped. That's what they're talking about. They'll make incisions, put the arthroscope in there, and do it. Oh man, I'm about to run out of juice. Give me a moment. Bone scan, they check that for a lot of different things, cancers and other infections and stuff. A CT or a CAT scan is a super X-ray that can show soft tissue. Normal X-ray, guys, does not show soft tissues. It's called a CT scan. It used to be called a CAT scan. I still call it that. Discography is where they look at the discs. MRI is another high-tech imaging. These two particularly are done all the time. This uses magnetism to create an image that can see soft tissues. X-rays are excellent, guys, but you cannot see soft tissues well with them. Use the following vocabulary slides to reinforce prefix and root suffix to get familiar with terms. You'll learn in more detail in A&P. I think Dr. Y put that in. Articular cartilage. Most joints, the end of the bones, at most joints, the end of the bones are covered with a cartilage. You can see it on a chicken wing. You're eating them wings, you pop it open, look, and it's real slippery. That's hyaline or articular cartilage. Articulation is a joint. Bursa, sac of fluid, near a joint, acts to diminish friction. Ligament, bone to bone. Meniscus, there are crescent-shaped fibrocartilage structures, two of them in the knee. That's what those are. Suture joints, immovable in the skull. Synovial cavity is space between bones within a synovial joint. There's a membrane that holds all that together. There's also fluid in there called synovial fluid. It's how the tissues of the joint are nourished because they don't have blood vessels going down into them. Synovial joint, freely moving. Synovial membrane around it. Tendon, we've gone over that. Connect muscle to bone. Okay, the first system we're going to study is the integumentary system. It only has one organ, the skin, but it's really important. The skin's the largest organ in the body. It weighs between 8 to 10 pounds, depending on how fluffy you are. There are several accessory structures associated: hair, nails, sweat glands, oil glands. But there's only one organ in the integumentary system, and that is the skin. The outer layer of skin, the one we see and feel, is called the epidermis. Epimember means on top of. There's a deeper layer called the dermis, where the blood vessels and supporting structures are. And then beneath that's a subcutaneous layer, also known as the hypodermis. It lays against the muscle. Skin color is determined by the pigment melanin. We have melanocytes that produce it. People with darker skin have more melanin. People with lighter skin have less. Melanin also determines hair and eye color as well. Skin color often is a key to disease. For example, cyanosis is blue. All of these are important to learn. It's from a lack of oxygen, like a breathing problem or someone having a heart attack, for example, perhaps. So the lips and the nail beds will start getting blue first, and then the overall body will. Jaundice is a yellow tint from the skin. There are different causes for it, but it's most often associated with liver problems. Ecchymosis is the medical term for bruising. Bruising is bleeding under the skin. It can be caused by somebody punching you, or it can be caused because you're on blood thinner and it's leaking too much. So ecchymosis is bruising. Bruising is bleeding under the skin. Accessory structures to the skin. The skin's the only organ in the integumentary system, but there are several accessory structures: hair, nails, sebaceous glands, which produce oil for the skin and the hair, and sudoriferous glands, which we know more as sweat glands. There's a huge number of sweat glands in the skin, guys. I mean, gigantic. Unbelievable almost. And they play a big role in this. Body temperature. Normal temperature of adults, 98.6 degrees Fahrenheit. If it varies by 10 degrees or so in either way, you are in very bad shape and will die. Pyrexia is the word for a fever. You need to know that. Pyrexia is a fever. Hyperthermia is when the body temperature is too high, like when you're having a heat stroke. Hypothermia is where it's too low, like you've been out hiking in the winter and you're trapped out in the mountains somewhere. Abbreviations. Dr. Awaya says you'll learn them over time. Don't be overwhelmed. I agree. AC is a acromioclavicular joint. It's these joints out here. ACL, anterior cruciate ligament. The one I mentioned, a lot of athletes have trouble with that and have to have it fixed. ANA, anti-nuclear antibody, BKA, below the knee amputation. Yeah, a lot of these you will not see, but but they might be asking a test for this course, guys. BM bone mineral density to tell if you have osteoporosis. Cervical vertebrae C1 through C7. Calcium, the element is abbreviated like that. Creatinine kinase is a, if I'm not mistaken, it's I want to say a kidney problem, but it might be something different. I'm forgetting. Creatine usually is. Carpal metacarpal joints are just where your knuckles are. Dual energy X-ray absorptiometry. I have no idea what that is. And I have no idea what this is. Disease-modifying anti-arrhythmic drug. Unless you work in that field, guys, you don't. And if it were me, I would not have this on here. Why? It's too obscure. DO is a doctor of osteopathy, pretty much equivalent of an MD. DTR, deep tendon reflexes, like when they tap your knee with the rubber hammer. This is important. ESR sed rate, erythrocyte sedimentation rate, is how quickly it takes red blood cells to settle down in a sample of blood. And it's an important test for inflammation. If you blow out a disc or have a herniated disc, it's called a HMP, herniated nucleus pulposus. The interior of the jelly-like portion of the disc is called the nucleus pulposus. IM intramuscular usually means to injections. Some injections have to go deep into the muscle. And NSAID, non-steroidal anti-inflammatory drugs like Motrin. There's several other ones. But that's the brand name. Ibuprofen is the general name. OA is osteoarthritis, most common kind of arthritis, or open reduction of fracture internal fixation. It's something to do with setting a broken bone. Orthopedics, the medical specialty that specializes in all this kind of stuff. OT, occupational therapy, similar to physical therapy, highly trained to get you ready to be able to go back to work. Phosphorus is an important element found in bone. PT is physical therapy. Great stuff. RA, rheumatoid arthritis. This is an autoimmune disease. So that right there makes it hard to treat. You should think that. Rheumatoid factors associated with that. ROM is range of motion. How much motion a joint should have in it. They measure those. SLE, systemic lupus erythematosus, is lupus, the disease. It's also an autoimmune disease. T1 through T12 are the thoracic vertebra. Total knee replacement. Arthroplasty. Total hip replacement. So in other words, if you know an older person had to have their knee replaced, that's what this is. And if you know one had their hip replaced, that's what this is. TMJ is the temporomandibular joint. The joint of the jaw up here. It's between the mandible, the jaw, and the temporal bone. Temporomandibular joint. Yeah, okay. Yeah. Because it's a difficult word, temporomandibular joint, it's perfectly acceptable in healthcare to call it the TMJ. Everybody does. It's also, guys, surprisingly, an area with a lot of problems. But I guess like me, there's a lot of people that use that joint a lot. Yeah, I think we're finished. Okay, let's whip back. We're got like 30 seconds just to see if there's anything. Again, guys, go through this. Concentrate on the words, the terms. This kind of thing, look at it, but you'll learn this in anatomy. Concentrate on these terms, because that's what this is. Okay? All right, guys, hang in there. Go to Quizlet. You can make your own cards or flashcards. You can go to Quizlet and see electronic ones. I would highly recommend you do that. When you're memorizing material like this, that's the best way to do it. I did it. Yes, indeed I did. I had a stack of flashcards like that. Okay, guys,